Hello friends, this is Dr. Navin Agrawal. I am an interventional cardiologist practicing at Valsad and Vapi district of Gujarat. My topic for today's discussion is regarding what time you should take your antihypertensive medicine. Is there any difference if at all we take the medicine in the morning or in the night time? What is more beneficial for the patient? This is what we will be going to discuss in this topic. This topic is going to be very practical and useful for all the patients who are taking hypertension medicine. So I would request you to see the video till the end. The people who are new to my channel, I would request them to subscribe to my channel, as this will give us a lot of motivation and inspiration to continue the good work. And also whenever we upload a new video on our channel, this will give you a notification of the same, and you can visualize the content as early as possible. Now coming back to today's topic, basically hypertension is something which is defined as a condition where the blood pressure is higher than what is expected to be normal for the patient. Usually by definition, a systolic blood pressure or the upper blood pressure beyond 140 and a diastolic blood pressure or the lower blood pressure more than 90 millimeters of mercury, that is considered to be beyond the normal limit. And usually for every 5 millimeters increase of blood pressure, the increase of stroke increases by, or the increase of paralysis incidence by increased by 34%. The incidence of ischemic disease or heart disease increased by 21%. And it can lead to a lot of heart failure, brain related problems, mortality, heart attacks. A lot of problems can be increased by the risk of blood pressure increase. So that is the need for control of the blood pressure. Usually whatever blood pressure medicines we take, a few of them have a 24-hour or a continuous duration of action, but a lot of these medicines have a crest and trough pattern. That is, there is a peak level which the medicine achieves and then it continues to decline for the next few hours. So it becomes very important for us to know what is the peak of the timing of the blood pressure medicines, and rather it becomes very important for us to divide our medicines so that we achieve a very sustained form of blood pressure and there is not much fluctuation in the blood pressure level over a 24-hour period, because studies have shown that more is the fluctuation of the blood pressure, more is the incidence of complications which occur to the patient. Secondly, there is phenomena which is known as early morning surge of blood pressure. In this phenomena, what actually occurs is that people who are hypertensive have a sudden surge of blood pressure levels early in the morning as soon as they get up from the beds. This occurs because of a large amount of catecholamine surge which occurs in the body, which makes the body prone to having increased incidence of heart attack, stroke, paralysis and heart failure related complications. All of us have seen, who are practicing cardiology, have seen in their practice that large majority of the heart attack patients, a large majority of the stroke and heart failure patients arrive to the hospital early in the morning, maybe 6 or 7 o'clock in the morning, because this is the maximum time where the incidence of heart attack reaches its peak, and the reason for it is the sudden catecholamine surge in the body. So what we need is a medicine which controls the blood pressure at this point of time, because if at all you are taking your medicine at 8 o'clock or 9 o'clock in the morning, then the peak of the blood pressure medicine or the crest will be achieved at 10 or 11 o'clock and the trough will be there at maybe after 8 to 12 hours of the taking the medicine. So if at all you are taking a nighttime dose of medicine, then you are more likely to have a good blood pressure control early in the morning before you wake up. Because if at all you take your blood pressure medicine at 8 or 9 o'clock, the medicine will take some time for the body to absorb the medicine. The medicine gets assimilated, gets into the blood, and then it starts to perform its action. So this process takes around 1 to 2 hours, and if you take your medicine around 8 or 9 o'clock in the morning, then the blood pressure levels will not be controlled before 10 or 12 o'clock in the morning, and this early morning surge of blood pressure will not be controlled if at all you are taking your medicine early in the morning. Howsoever early you take, even if you take it at 6 o'clock in the morning, then the effect of the medicine will come by 2 hours, maybe 8 or 9 o'clock. So the problem which is occurring at 6 o'clock in the morning will not be controlled unless you take your blood pressure medicine at the night. That is why studies have shown that blood pressure control patterns is much better if at all you are taking blood pressure medicines at night time. Usually the nocturnal dip and the early morning surge phenomena, everything is better controlled if at all you are taking your blood pressure medicines at the night time. There was one big trial which is known as the HYGEA trial, which was done in 19,000 patients in Sweden. This trial showed that if at all medicines of blood pressure were taken at night time, the risk of heart problems and heart attack was reduced by around 65%, and the risk of angioplasty requirement was reduced by 40%, heart failure by 42%, the incidence of stroke and brain paralysis was reduced by 49%. So if at all we consider this trial data evidence to be true, we have to follow the fact that if at all you take your medicines at night time, the incidence of cardiovascular problems and heart attack and stroke and paralysis and revascularization related problems are much lesser if you are taking your medicines at night time as compared to medicine which are taken in the morning time. A lot of other small trials also have shown that night time medicines taken are better as compared to medicines which are taken early in the morning. There was one other medicine trial which was done in sleep apnea patients, on 41 patients of sleep apnea. This trial also showed that the blood pressure control was better if the medicine was taken at night time as compared to morning time. Some medicines like the diuretic which increase the urine should be ideally taken in the morning time, because these drugs can increase the urine formation at night time, and it can be very bad for the patients because elderly patients have to go into the urine for passing urine multiple times at the night time, which becomes very inconvenient for these patients. So diuretics or urine increasing medicines ideally should be taken early in the morning. Beta blocker medicines ideally should also be taken in the morning, because as it is in night time the heart rate of the patient gets reduced as compared to normal, and beta blockers per se reduce the heart rate of the body. So that is why if at all you take beta blockers at night time, the heart rate will fall very low levels at night time. That is why it is recommended to take beta blockers in the morning. Blood dilating medicines or vasodilators ideally can be taken at night. So if at all you are taking multiple medicines, you can put the diuretics and the beta blockers in the morning and the vasodilators at the night. So it will give us you a very good 24-hour control of the blood pressure, and the nocturnal dip of blood pressure and early morning surge of the blood pressure, everything will be controlled better if at all you are taking your medicines in a divided form. The fluctuations of the blood pressure will be much better. So in this topic I have tried to discuss the fact that taking blood pressure medicines both in a divided dose is better as compared to you are taking all the medicines at one point of time, because if you are taking all the medicines at one point of time, the blood pressure peak of all the medicines will come together and the BP levels will crash at that point of time, and when the level of the BP medicines goes down by the evening or by the night, then the blood pressure will again start to shoot up, and the early morning surge of blood pressure will not be able to be controlled. So if at all you have multiple medicines, it is better to divide them with half of the medicine in the morning and half in the night. And also if at all you are taking one only medicine, it is better to take the same medicine at night time, because the early morning surge of blood pressure will be better controlled by a night time medicine as compared to a single morning dose medicine. The purpose of my topic is that I wish to make scientifically correct and useful information easily available to you in easily to understand language, so that you can take best advantage of the disease, the information to better manage your disease and to discuss the disease better with your doctors and your friends. Usually for this amount of information, people tend to depend on their doctors and friends and relatives to get this information. Doctors, because of time constraint, may or may not be able to give you all the information, and friends and relatives usually have a half or partially correct information, which if at all you follow can be detrimental to you in the long run. That is why we want this content to be easily available to you, so you need not run away to multiple places to get this gather this information. If at all you like the concept of my channel, I would request you to subscribe to my channel, to like the videos, and if you feel that the content is useful for your friends and relatives, kindly share the video link to your friends. If you feel that there are some queries regarding to the topic, or if you want us to discuss some more topics in future, you can mention about them in the description box below, so that in future we could take up those topics in our subsequent videos. So this is Dr. Navin Agrawal, and I thank you all for a very patient listening, and I would really appreciate the new people who are viewing my channel for the first time to subscribe to our channel, so that it gives us a lot of inspiration and motivation to continue the good work which we are doing now. Thank you.